It took 1 year to do everything. So it was not an easy process. It was not fast.
Manitoba is facing healthcare staff shortages with longer wait times in emergency rooms. At Health Sciences Center Tuesday, the wait time is about 9 hours. But still, many internationally trained healthcare professionals find it challenging to prove their diplomas and start working here. Olhana Misnak is an internationally trained nurse with 12 years of experience. She arrived to Canada as a Ukrainian refugee 3 years ago. To prove her credentials, she had to balance work and licensing efforts.
As well, you have to do your credential and things like that. It was not easy, especially when you are the mom of two kids. It's not easy to do everything at once.
With 1 year and over $3,000 spent, she still cannot land a job. Nemesnik says recognized credentials are not enough, as many institutions require local experience, suggesting volunteering as an entry-level opportunity.
It's also not easy process to find a job because first of all, you are not having the practice in Canada as a nurse. Even if you had practice in medical facilities, it also doesn't help you because taking care of the patients is very different from working in the medical clinic, and it also challenging to find a job because you need maybe do some volunteering job, or you have to be connected to the facility you want to work.
The federal budget presented Tuesday suggests $97 million over 5 years to create a foreign credential recognition action fund. According to the College of Registered Nurses of Manitoba, foreign nurses make 16.9% of all registered nurses in Manitoba. A statement reads, federal investment in this area must focus not just on expediency, but also on ensuring that internationally trained nurses are well positioned to succeed when they enter the workforce, ensuring that there is reasonable harmonization of professional standards and supporting programs from coast to coast to coast.
Our culture in our healthcare system has not been healthy for a long time. We have nurses that are working here right now who are leaving our system because of that culture. So I think that this government needs to really look at how do you retain nurses once you get them here? Because you can recruit all the nurses you want, but if you can't retain them in our public healthcare system, we have an issue.
After freezing a number of automated rejection emails, Nemesnak managed to get a job interview for a position that does not provide a competitive wage.
I had one interview, but the work was not related. It was related to nursing, but it was not paid as a nursing, and maybe because this clinic is related to the hospital, so maybe I will try to work with them first, and in the future, maybe I will get work as a nurse.
City News contacted the Office of the Minister of Health, Seniors and Long-Term Care, but did not receive a response before the deadline. In Winnipeg, Sofia Frolova, City News.